Growing up, both my parents were physicians, and that's the last thing I thought I was going to do. But then when I started college, I found myself sort of gravitating more towards medicine. My name is Menachery, physician owner at Hematology Oncology Associates of Fredericksburg. I started college at the University of South Carolina. I went to medical school at St. George's University in Grenada in the West Indies. And after that, was an intern and resident at Hahnemann University in Philadelphia. I actually stayed there to finish up my fellowship in hematology and oncology. I interviewed at a lot of different practices. This was one of the two practices that I had narrowed down my search to. It was much more personable, and I felt like I could grow into the community. And that was also some of the keys to what I was looking for. And it really did stand above and beyond all the other practices that I had interviewed at. Dr. Muir founded the practice, but now Dr. Maurer and I have been working together for close to 13 years. Dr. Vaughn joined us a couple of years after me in 2008, then Dr. Whitehurst more recently in the last 4 years, and then Dr. Moore and Dr. Simmons. And we have a very collegial relationship. We get a chance to talk about cases. We get a chance to share our experiences. And it's really sort of sharing these experiences of taking care of patients that I think helps improve the quality of care. I think the first thing I'm trying to do when I meet a new patient is just trying to assess what are their expectations. What do they understand? Do they know about their diagnosis? Who asked you to come see us? And did they tell you why? What is their support? What are the potential options? What is the plan of attack moving forward, especially in an oncological diagnosis? What is the standard of care? For every diagnosis, it's going to be a little bit different. I don't think it's one size fits all when we take care of our patients. Trying to personalize the treatment plan is probably the most important thing. Every physician has a care team. They really get a chance to know the staff, and also the staff gets a chance to know the patients. It's not a different patient every week, every other week, et cetera. So they can say to them, how are you doing? How did you tolerate the last chemotherapy? What side effects did you have? What adjustments do we need to make this time? In our laboratory, we're continuing to expand on some of the services, and we recently added a flow cytometer to our laboratory services here. And it helps us define certain blood disorders, cancers, specifically leukemias and lymphomas. So we're able to do that here now. To the best of my knowledge, we're the only ones that actually has that technology here locally. One of the main benefits to having a pharmacy in-house is almost like one-stop shopping. The patients are coming into our office frequently to be seen. If we need, for instance, need to make an adjustments to their medications, we can make that adjustment right then and there, and then they can actually pick up their drugs in the pharmacy on the way out. I feel very fortunate to be practicing oncology in this day and time. There have been so many drugs that have been approved for the treatment of cancer in these last 5 years, and more so in the last 10 years. We are inching our way there. We want to keep pushing the buck and hopefully help cure more and more patients with the newer technologies that are coming about. When I first joined the practice, I never thought about what are going to be some of the other side benefits of becoming a member of a small practice and eventually becoming an owner as well. Witnessing the growth that we all have participated in. We help support about 100 families, and I think that's really neat to see something we've invested so much, blood, sweat, and tears into grow like that and have an impact not only on patients, but our community, our employees. It makes me really proud.